In addiction treatment, there's something called the stages of change, and there's 5 of them. No, actually 6, but 5 that we're going to focus on. The first one is pre-contemplation, and that is absolute denial. And unbeknownst to most people, that is an extremely rare stage. A lot of people mistake denial for denial of a problem versus denial of us having to address the problem, and there's a huge difference. Very few people are in denial. And you can always tell if somebody's in denial by the reaction, the response that you get. So when you tell us that your loved one's in denial, we have to look at whether or not they're in denial of a problem or if they're in denial of having to address the problem. The second stage is contemplation, which means the substance user makes a decision to either stay where they're at or move forward in the stages of change. The third is called preparation, which means they prepare for treatment. That is a very short-lived stage, and that does not have to occur very long. And the next one is action. They actually enter treatment, and then maintenance, which means their ongoing recovery. And I like to call maintenance the growth stage. The 6th stage is the relapse stage. I don't talk about that often. We don't see it a lot in textbooks, but if somebody relapses, what happens basically is they recycle through the stages of change. The stage that I want to focus on is called contemplation, and that's where interventionists sit, and that is the pivotal part in the whole process. Because once you move through contemplation, you move right through preparation and into treatment, and then onto your recovery and your aftercare. The contemplation stage requires the consequences of the lifestyle to become greater than the benefits. This is a clinical scientific fact. This is not an opinion. In order to move through the stages of change, the intended patient must feel and see consequences greater than benefits. That's undisputable and not debatable. So when a family system, through codependency, enabling, and comfort, provides just enough of those things to prevent that person from feeling consequences and allows benefits to prevail, how will they ever move forward? It's not about you calling our office saying, I need to get them help. It's about us helping you understand why they won't get it. And it always lies within the environment, which is the #1 predictor of outcomes. Behaviors are not always defined by the pros and cons. They're defined by the outcome. In other words, a negative behavior can produce a positive consequence. And when that happens, they do more of it. And when you enable, and when you're codependent, and when your whole family's not on the same page, and everybody has an opinion, and dad doesn't want to do this, and their oldest brother wants to come out and say, I'm going to take charge of this situation and talk you out of it, you're preventing your loved one from moving through the stages of change. You're allowing negative behavior to produce a positive consequence. If you really believe that they have to want help and hit bottom, how are they going to do that if you're standing in the way? Our entire job is to help you see why they're not accepting help. I know you want them to get it, but there's a reason why they're not, and it's because they're stuck in the 2nd stage. And we need to help you. We would like to help you move them out of that stage. But in order to do that, I've got to turn your no to a yes to the intervention so that I can turn their no to treatment to a yes to treatment.